Hi guys, this is Adrian, and this is my video for 623, my first article for discussion on the discussion board. So if you look in my post on the discussion board, you'll see a link to my article, just where you found this video link. So the name of my article, or the title of my article, excuse me, is The Use of Shaping by Relatives of Autistic Children to Increase Food Intake. And it's by Ana Arantes, Maria Martone, and Ricardo Martone. And the article was originally published in the European Journal of Behavior Analysis, and the DOI number is also in my article link. So I'm just going to talk about the article and describe it and summarize it a little bit in this video. So first, we can start with the purpose. So many children and adults actually have issues trying new foods and expanding their palates. It's something that's pretty normal and or pretty common at least. And pickiness is especially common in children. I'm sure those of you with kids already know that. And children with special needs are no exception to this. In some cases, it can be even more difficult to get them to try new foods, especially if they already have a very established, specific type routine. It's kind of hard to change that up, but it can be done. And so this was the case for the subjects of this study. There were two participants. There are two boys, young boys who have autism, and they had a history of, having difficulty trying new foods and just getting proper nutrition. So this was definitely something. The focus of the study was definitely something that the parents also did want to have changed. They did want to change their behavior a little bit and have them try a little bit, have a greater variety of foods that they try to eat. So the purpose of the study, to be more direct, was to assess the efficacy of shaping and differential reinforcement in increasing the food intake of those two boys that I had just described. So the rationale is that using these behavioral techniques with shaping and differential reinforcement, and by using approved scientific designs, and in this study, they used multiple baseline as well as changing criterion designs. So by using the behavioral techniques in those designs, the authors will be able to show a clear connection between the behavioral techniques and a change in behavior in the two boys. And the change in behavior, again, is eating more in terms of variety and types of foods. So to get more into it and into their methods, there were two phases in this study. So the first phase was the multiple baseline design, and 3 new foods were introduced to the two boys in this phase separately. So actually, the two boys were both in their own homes, and the interventions were actually done by their parents in their own home, but under the supervision of one of the authors was present in the home as well. So in the first phase, 3 new food items were introduced, and they used a multiple baseline design, which means that they started at baseline, took data, introduced the new food, new intervention, and the intervention was differential reinforcement as well as shaping, like I said. And then they would take that away, go back to baseline, and then add in the new food and the intervention again. Just I'm sure you guys already know that, but just to detail it a little bit. And so ultimately the authors systematically increased the acceptance response to the foods that were introduced, and again, using differential reinforcement and shaping. And then in the second phase, the boys were required to eat more than just one type of food. So instead of just having to try one type of new food, they were actually required to have more than one type of food during each meal, or during at least one meal that they were studying at that moment. And the authors used a change in criterion design for that phase. And so it is important, again, to note that the parents were the ones that were implementing the procedure, just being supervised by the author in the child's own home. And after the conclusion of the experiment, actually 3 more new foods were introduced to the boys. However, it was up to the parents to just follow the procedure. They were asked to follow the procedure without the supervision of the author. And this helps, long term just to keep this behavior going and have them trying new foods regularly in the home, because there's not always going to be the author there supervising this. So it was just part of the study that the authors had added in to help this behavior continue that they wanted. And so results, the boys did start to accept more food, so it did work, and they did increase the variety of food that the boys accepted. So that was really good. It ended up working out, and differential reinforcement and shaping really did help them try new foods and expand their palates. And the parents also learned how to introduce new foods effectively to their sons' diets, and that's something that's very positive, and hopefully long term. So to get into the discussion a little bit, I did have a few questions about the article for the authors if I were to ever have a chance to ask them. And one question would be, how did they choose which food items would be used? Were there food items that the parents, already knew their kid didn't like, or did they just pick, randomly? They didn't really go into that as much. So I would like to know a little bit more about that. And did the parents have particular foods that they did want? And sorry, just how did the parents' opinions weigh in to the experimental design? And how did the effects of the study last? I would want to know more long term. I know that they had, the thing at the end where they had the parents, try it on their own, but how did that last? I would want to know more about that. And do the boys still continue to try new foods to this day using this method? Does differential reinforcement and shaping work long term, or is it something that, wears off after a while? I would just want to know a little bit more. And how would the results of the study differ had it been conducted in a lab setting and not at their home? And if it was conducted by just the authors and not the parents, how would that have been different? What other factors would have influenced the subjects as well? And then, so I have a couple open-ended questions just to start the group discussion. What types of techniques have you used with children who have food aversions or are picky eaters, or who have trouble accepting new foods? In your own experience, what have you tried? What's worked? What hasn't worked? And do you think there are more effective methods than differential reinforcement and shaping to accomplish this goal? And I'm going to leave it at that. Thanks so much for listening, you guys.